Thank you so much to all of you for joining this session. I'm really excited to see some of the faces that we had at the plenary because I feel that some of the topics that really came out this morning touched a bit on what this session is all about. So today you are in the verbal session on governance, policy, and systems strengthening. And the nice thing about this session is that it focuses on very important topics related to water subsidies, topics related to strengthening wash systems, regulating water and sanitation, strengthening wash and infectious disease prevention. And some of our speakers are really going to cover aspects of the work that they have been doing in the sector, but also in academia. And yeah, I will be inviting our first speaker. Before I do that, I am Sifiso Dlamini, a doctoral researcher from Loughborough University, and I will be moderating this session for today. If you could just give a warm welcome to our first speaker, Saumitra.
Good afternoon. My name is Saumitra Shinha. I received my doctoral degree from the Department of City and Regional Planning at UNC Chapel Hill this May. And I will be presenting research that builds upon my dissertation that examined Delhi's free water policy. In my dissertation, I wanted to explore how the diversity of people's views and preferences could be incorporated into decision making in cities with very large populations such as Delhi. To do that, I examined Delhi's water subsidy policy and the water budget allocations from the perspective of people who would be affected by them. And by doing so, I questioned the prevailing strategy adopted by many governments of subsidizing water and providing it for free in order to make water affordable. There is little consensus on how affordability can be assessed, and with resource constraints, water subsidies need to be evaluated within the water sector in relation to other objectives besides affordability and also in relation to other welfare schemes. I used stated preference techniques administered through a survey of 728 households to explore three aspects of water sector budgeting from the perspective of people. First, preferences for water subsidies versus service quality. Second, views on alternative water subsidy targeting strategies. And third, water subsidies in relation to subsidies in other public sectors. In some countries, welfare schemes or subsidies are provided together. In others, there are different mechanisms and criteria for providing subsidies. So how are subsidies in water different from subsidies in other public sectors from the perspective of people? I'm focusing on this question in today's presentation. Delhi has a population of 20 million people, and the water subsidy policy, which was instituted in 2015, benefits about 1.4 million households. However, it cost the government $65 million in 2021, which was 18% of the water and sanitation budget. About 50% of the water supply in Delhi is unaccounted for, either lost through leakage or theft. The service quality in Delhi is also poor, because of which residents have to adopt coping mechanisms. In Delhi, if a water connection uses up to 20,000 liters of water a month, there is no bill. If water use exceeds that threshold, an increasing block tariff for 3 blocks is used to charge for water. In this case, even the first 20,000 liters of water is charged according to the first block, and no subsidy is provided. People in Delhi can get a mix of different subsidy schemes that are either from the central government or from the Delhi government. The focus of this study was on five subsidy schemes by the Delhi government and was inspired by a 2020 study by the government on the impact of Delhi government schemes on low-income households. The 5 schemes were on water, electricity, education, healthcare, and a scheme to provide free bus rides for women. The water subsidy scheme is available to all households, with the condition of usage. Households can self-select to get the electricity subsidy, the education subsidy, or the healthcare subsidy, and the free bus rides for women is a targeted subsidy. The government study found that households save about 32 US dollars per month from all the subsidy schemes on average, which is about 14% of a monthly household income of about $237 or 20,000 rupees. The highest share of savings on average was from the electrical subsidy and healthcare subsidy. The water subsidy contributed the lowest amount. I utilized a stratified random sampling strategy based on neighborhood types, and the study was part of a larger study. So the households that were in slum neighborhoods were not included in the study since they are not provided household water connections and are so not available for the water subsidy. These are some statistics from the survey to give you some idea of the water service conditions in Delhi. Only 72% of households get pipe water supply every day. On the days that they do receive water, most households are supplied water once or twice a day. Most households receive water for about 3 hours. Because of the poor quality, 23% of the respondents said that someone in the household had fallen sick because of poor quality water in the past 12 months. 86% said that they treated water or bought bottled water. 68% said that they had to rely on some alternative water source. And almost all households have to store water, the burden of which primarily falls on women. In this part of the survey, we first asked households which of the 5 subsidies they had benefited from in the past 12 months. And then following a best-worst scaling methodology, we asked the respondents to imagine the situation in which the government has to remove a subsidy scheme because of budget cuts. And then we asked from the 5 subsidy schemes listed, which subsidy scheme do you think the government should remove? Once they made their selection, we removed that option and then we asked from the remaining 4 options, which subsidy scheme do you think the government should not consider removing it? And then again, which of the schemes they think the government should remove and then not consider removing to get a full set of preferences. At the end of the exercise, we asked respondents open-ended questions to understand why they made their first choice to remove a subsidy and first choice for not considering for removal. They could give multiple reasons and they were not read out any or suggested any choices, but the enumerators had a list to make it easier to document. The sample was split equally between men and women. The mean age was of the respondent was 43 and the median household size was 5. 85% of the households were owner occupied and 21% of the households shared water connections. In the sample, the households benefited the most from the electrical subsidy, followed by healthcare and water subsidy, and then free bus rides for women, and then the free education in government schools. The water subsidy sector was selected to be removed first by 19% of the respondents and not to be removed by 7% of the time. Free bus rides for women was selected as the subsidy to be removed first by a majority of the respondents. The healthcare and education sector was selected to be the one not to be considered for removing the most number of times. These choices were then analyzed using a series of multinomial logit models, and the coefficients associated with each subsidy sector represent the magnitude of the difference in the preference between the alternatives and the reference level, which was set to be the water subsidy and fixed at 0. The positive coefficients imply that subsidies in those sectors are preferred over the subsidies in the water sector, and negative coefficients imply that the subsidies in the water sector are preferred over them. These results provide a ranking of the subsidies. but also values that can be used as measures for the magnitude of their preferences. So the water sector subsidy was the second lowest ranked subsidy of all the 5 sectors. In a subgroup analysis, we found that none of the subgroups differed in their ranking or in their preferences. So the reasons for this water subsidy to be not removed that were cited were the highest was the subsidy is essential for people and that they really needed the subsidy, and then people who needed it got the subsidy. The top 3 cited reasons for removing the water subsidy were that they did not require the subsidy, the quality of service was poor, and that the society benefits least from this subsidy from our government. To give you some context, the electrical subsidy was cited to not be removed because they needed the subsidy, and people who needed the subsidy got it, and they were able to meet the requirements of getting the subsidy. The electricity was cited to be removed first primarily because it was difficult to get the subsidy because of poor documentation. Interestingly, the healthcare and education sector, both of them were selected to be the most preferred because people said that it was essential for people and that the society benefits most from them and that people really needed that subsidy. I think it's important to discuss the result that free bus rides for women was ranked the lowest. I want to emphasize that this does not mean that it should be removed, and 70% of the respondents who selected it to be removed first said that they did not require it themselves. It is a direct subsidy to women, which is very important. A study found that 62% of people walked 0 to 1 kilometers to get to work, and so it's important for women who live on the outskirts of the city and have to travel to work or for any other reason. To conclude, we need to recognize that water subsidies are part of a larger welfare efforts and that the reasoning given for water subsidies equally applies to other sectors and the value and that the subsidies in other sectors such as healthcare and education may actually be both beneficial and easily accessible to people.
Thank you so much for that very insightful presentation. I will be taking a few questions for Saumitra. Does anyone on the floor have any questions?
Hi. I was wondering if either if this was covered in your survey or if you had any conclusions you could draw from observations or from talking to people about whether the perception of the subsidy is to do with the service level and whether if the service level improved or increased coverage, whether that would change how important people felt the subsidy was.
So as part of the survey, there was a study to also see how people compared or perceive water subsidies in comparison to improvements to the service levels. And so we found that people actually preferred or would be willing to give up the subsidy in order to get more intensive water quality testing at the neighborhood level. So it is hard to say how things or how perceptions or preferences might change over time, but currently it seems that a lot has to do with the poor quality service.
Thank you so much.
Thank you for the presentation. It's a very interesting study. One question I have kind of carrying over from this morning talking about water and sanitation subsidies is, does it make sense efficiency-wise for one central agency to really coordinate across all of these different subsidy offerings? Or does that efficiency carry too much risk in terms of if you're identifying for poverty targeting for healthcare, does that not really apply then to water or schools? If you could maybe address that.
Thanks for the question. So it really, I think it really depends on how the subsidy scheme has been conceptualized. So if there's self-selection, which is if someone, if a household member decides to send their children to a government school and get subsidized education, or decides to go to a healthcare institution by the government to get subsidized healthcare. So there's some amount of self-selection there, but it also relates to quality of services. So with the water sector, there is no targeting as such, but there's the stipulation that you need to keep your water use up to a certain level to be able to get the subsidy. So in those circumstances, I think depending on how a service is being provided, I would say it really depends on that, about how people get, about the efficiency of providing subsidies centrally or individually.
So if your question could just be brief, because we're running out of time. We've got an additional 1 minute.
Great study. Quick question on the household budget type of framework for this. How comparable were the subsidies in terms of value across sectors?
So if I understand your question correctly, you're asking about how the households benefited from the different types of subsidies.
Your economic value, yes.
Yeah, so in my survey, I did not ask about the economic value. There was a study conducted by the Delhi government which only considered low-income households. And in that, they found that the healthcare and the electrical subsidy contributed the highest amount of the subsidy, and water was the lowest.
Thank you so much, and thank you for your presentation. Please help me welcome our second presenter, Lauren, from the London School of Hygiene and Tropical Medicine.
Hi, good afternoon, everybody. So I'm Lauren Managai. I'm from the London School of Hygiene and Tropical Medicine. I'm representing a fantastic bunch of people from the FCDO Wash Systems for Health programme, which is kind of a consortium between IRC Wash, LSHGM, leads and funded by FCDO. I'll be presenting on the priority research questions for wash system strengthening, and this is the results from a Delphi exercise that we've been conducting for the last kind of roughly a year and a bit. So maybe just to refresh everybody's mind is thinking about what is wash system strengthening. We've had it around the conference a few times, but just in case. System strengthening is thinking about the actions and the supporting interventions that are considered to strengthen one or more elements of a system. You can see here I've got the agenda for change kind of infographic to show you the multi-components of a system. So this includes strengthening different factors, could it be finance or monitoring or learning adaptation, as well as the capacity of the actors within that system kind of for better functioning. The aim is for systems performance, but really the quality and the sustainability of WASH services. And over time, as more building blocks are strengthened, we begin to see a strong and resilient system. But why WASH system strengthening? Now, conventionally, international development actors have been focusing on kind of direct distribution or direct delivery of infrastructure, but often these kind of fail sometimes without that continued external support. So WASH system strengthening is gaining traction, so a kind of logical response, but also thinking more financially and fiscally, kind of to responding to those weaknesses in more direct delivery. But there is some weaknesses in that evidence base. There's kind of a limited evidence on the effectiveness of system strengthening research, because of the novelty perhaps of this kind of concept, but also the time needed to see that systems change, and then a lack of monitoring and evaluation data. So if any of you were in the side event this morning, think about indicators, very relevant. But so we conducted a research gap analysis to kind of start to think about how to fill this gap. And so this is a Delphi process. There's many steps. I'm going to walk you through the steps of the process we've been undertaking for the last year and a half of how we've got to a kind of list of priority questions. So we started with kind of a multidisciplinary team. We've got individuals from our consortium, IRC WASH, Leeds and LSHDM to think of our kind of scientific committee. But that's not enough. We wanted to expand this further. So we contacted as many international WASH experts as we could via the mailing list of SWA, Sanitation and Water for All. And then we started finding the data sources. We reviewed all the kind of academic literature we could find on system strengthening to find those research gaps. We looked at lots of great literature sources and tried to find everything we could on the internet, again, identifying key gaps that the sector had been articulating. And then we conducted these kind of listening and capturing exercises. If any of you were here at UNC last year, you might remember me. I basically asked you to write down every research gap you could think of, and then I basically kind of stole them all from you. And we did that, and we did that at the All Systems Connect conference too. And then we started pulling them together. So research gaps are something, but it's about articulating a research question. So we had our teams kind of think about what gaps were there, but refining them, rewriting them, and actually making them into research questions. They've been reviewed by a scientific committee who actually know how to write a research question, so quite handy, and a team of individuals. And then we started piloting this. We kind of sent this out to a few people to say, we've got this list of 100, what do you think? And they said there was lots of duplication in there, so we got that list down to 77. So we sent the survey out in a first round in April this year, and just said, of these questions, which ones do you think should be prioritised? You know, we all know that we've got limited resources, but kind of thinking through the next kind of key questions we want to answer. So we sent it out. And based on a Likert scale, so 1 to 5, how much do you agree with this question? We can then start to think about the ranking of those questions. And so you have kind of cut-off points in a Delphi exercise. It's typically the median or upper quartile with interquartile range. And those that could drop below the median of agreement of saying, yes, we think this is a priority, and get kicked to the side. It's just on the methods. But anyway, you do the survey again. You want to make sure that wasn't just kind of a whim or somebody felt the same way one day, you check they want to feel the same way the next day. You do this again, you do a second round of the survey on those top questions, and finally, we get this list and we calculate the rank of those questions. It's very method heavy, but I will get to the results in a second. Kind of defining the consistency, the stability of the responses, how do people feel between those rounds, and seeing what they thought. And then we held successive webinars with this group of fantastic worldwide experts saying, what do you think? What do you think of the results? Do you validate them? Is something missing? Are there key questions that are missing? And thankfully, they all agreed. But yeah, so now we're kind of in that presentation stage, we're disseminating the results, and I'm going to show you the questions. So first, before I begin, who took part? So in between rounds, we had 81 individuals from across the world who took part in our Delphi exercise. They gave up their time, this is hours of their time to take part. 68% of them are male. We can always hope more, but you never know. And then round 2, we had 69 of those same individuals taking the survey. They came from quite a variety of organisations between the different rounds. So we had governments, we had NGOs, both at the local and international scale, academics, donors, UN agencies, and then this group of others who were typically more ad hoc policymakers or kind of private sector organisations. So we had lots of different people kind of voicing their opinions on this. When it came to geographical spread, we had a mix. Unfortunately, we didn't get anybody from South America or Central America taking part, kind of limitation of the survey that we are going to acknowledge, but we got kind of a mix of settings that people came from. So here are the list of priority questions. Now, I'm not going to make you read this horrendous text, I'm just going to summarise it while probably some of you do read it. And we've got things, I'm going to talk about the building blocks. So you're talking about that kind of systems level building blocks. And we can see that the questions come from many different building blocks of these key areas. Lots of kind of general questions on learning and adaptation, perhaps. There's questions on climate resilience or gender responsive programming, or how we integrate with WASH and healthcare facilities, and more those kind of interlinking parts of the system. We've got key questions on regulation, on monitoring and finance. Go to the next list. But we've also got questions on political economy. How do we engage those high political actors in WASH, thinking about planning, thinking about kind of other aspects of service delivery too. So you can see there's really key questions across the building blocks and how they're all going to be interlinking with each other to strengthen the system as it is. We will be disseminating this very far and wide, so don't worry, I'm not going to make you read 25 minutes very quickly, and we will be kind of sharing. We've got some handouts that are going online shortly to do this too. But again, I want to talk one of the kind of key areas of research that we found. So lots on climate change resilience. You know, we can't ignore what's happening. It's kind of where we're all going. But it's now thinking within the systems lens and systems financing and now climate financing. These are key questions that are emerging in system strengthening. Secondly, it comes from gender equity, social inclusion and human rights. Now, systems is about equitable delivery. It's about sustainable delivery. So we do have to think about these factors that we're not leaving anybody behind. And lots of questions centering on those approaches. We've got political support and government-led processes, and how do we engage more people in these actions and kind of harnessing political support for systems-level action rather than just direct service delivery. Sustainable financing. So what does that mean? But then how do we actually engage with this and across different sectors, especially those intersections of wash and healthcare facilities, wash in schools and elsewhere, which is very different budgets from a typical wash budget. And then lastly, and again, really ties in nicely with this morning's side event, is about monitoring and data-informed decision-making. It's not just about building the evidence base, but it's about how you read data to make data stronger in a country in order to then have systems change for the long term. So those are our key kind of thematic areas. But my kind of conclusion, it's not actually a normal conclusion, it's a call to action. So we've produced this list, and we've got a list of 25. It's not for just us as a consortium to take forward, it's really for the sector to be taking forward. So first, we're asking for donors, obviously, we need some resources for this, but we need an investment at this time, at this kind of crux point for system strengthening, to invest in the research that's going to show us how system strengthening approaches work, and the evidence base about moving them further forward and, you know, testing different things out. We need governments themselves, of course, to integrate that evidence generation from system strengthening, but to be active in themselves and sharing the learnings that they're taking and the new approaches across different settings, and sharing that with the wider WASH community and supporting, again, evidence-informed decision-making. Academics, I'm looking to many of you who are in the room, and myself included, is actually to respond to research needs. There's a list of questions. It's great to come up with questions on your own, but like the sector's giving you a list here, so I'd run with it. There's lots of PhD students in the room who could take these forward, and so we're asking you to start fulfilling some of these gaps. And also working again with the government, with implementing agencies to test a lot of these things out. And then lastly, to implementing organisations who are on the ground doing the systems change that we want to be seeing. It's how to incorporate that research and learning into the programmes, but conducting the research that we need that's both relevant to themselves, but so then all of our learning around it. Lastly, thank you very much. I haven't got a QR code for the list, it will be coming very shortly, but this is the QR code for the programme. It's where all of our resources will be going. You'll be seeing the updates from the Water Systems and Health programme. And really, the whole point of our programme is to keep you up to date with what's happening and testing some things.
Thank you so much, Lauren, for that comprehensive presentation. I think I learned a thing or two. Yeah, does anyone in the audience have any questions for Lauren?
The key, oh sorry, thank you. Yes, thank you. Of the key areas of research that you outlined, was there anything surprising for you, like either anything which you were expected to be included that wasn't, or anything that was included where you're like, goodness, that's not what I would have picked?
Thank you for the question. I think it's a very good question. I don't think there was anything necessarily surprising. I think we maybe didn't anticipate how much climate focus there would be, and especially because the evidence base for system strengthening is not as big as, you know, the classical direct delivery infrastructure evidence base. But I thought there would be more kind of key questions on how do the building blocks work and things like this. But I think that's just the mindset of the sector is so climate focused that of course it's intertwined with now within systems thinking and systems strengthening. So that's the biggest surprise from my side.
Thanks, Lauren. Will from SHA. So super useful, and 25 is hard to kind of distill that. I think in that list, and then in the summarised things, it's good to keep on coming back to the system strengthening bit of these, because otherwise there's a risk of just going off in a tangent of looking at Jesse without a strong systems lens. What does a strong system need to look like to be able to deliver inclusive stuff? So I think it's always good to kind of link that back to the systems analysis in this bit. I think it's also good to look at or to understand the extent of, this is what people are saying there needs to be research on versus what there actually is already quite a bit of research on. And kind of balance that, because it might be that there is some stuff there, but there's a lot of activity going on, climate resilience, for example, where it makes more sense to sort of really focus down on where the gaps are. as well. I just wondered, as a key question, is as a WASH system, as one of the program kind of implementing partners in West Africa, how it links with the forward-defined learning themes of the WASH systems for health that could be useful to share and sort of see how this list is separate to those 4 things. Thanks.
Brilliant. Thanks, Will. No, it's really helpful to get that insight. So within our WASH Systems for Health programme, we've identified kind of 4 key areas within systems, strengthening research that kind of come, thematic conversations that have come forward. The first is how to make climate resilient WASH systems. The second happens to be gender equity, social inclusion and human rights. And then it's thinking about how to move from basic to safely managed. Something that I think needs to be tested, needs to be tried. We're still learning. There's a side event on Friday that's going to go into much more detail, led by RC WASH. And then the 4th one being measuring systems change. Again, a side event this morning. Fantastic. So you've already been engaging with these. And these we've kind of found massive gaps, really, and understanding those core themes. And so that's where we're going to be focusing on for the next few years within all of these programs. But that doesn't still take away from the kind of point you're making about the systems lens that you have to take with all of this. Because if you look at some of these questions, they still are grounded in the systems approach. It might be climate resilience, but it's about climate resilience. Good question number 1 is how it's integrated within national WASH programs or policy. And that's kind of in financing, in the block on monitoring, on planning, it's spread across them. So it's still thematic areas, but it's where within systems we're addressing some of those issues. So I kind of would watch this space. I think a little bit from the WASH Systems for Health, we've got fantastic implementing partners in the room. And so there's going to be lots going on. We've got 6 countries that we're going to be learning from for the next 4 years. And we're going to keep producing as many things as possible, but engaging as many of you, if you want to, in these processes, in this kind of topic, to keep learning, because I think we're all going to have more evidence on what we should be doing.
Yeah, thanks, Lauren. This is Rachel from Tier Fund. Just a really quick question. I was trying to go through all the building blocks that you've listed there, and obviously you're using one particular framework for your building blocks. But was there any of the building blocks in your framework where you didn't identify a research question?
No, all the building blocks were covered. So we used, make sure let's go. Building blocks. All the building blocks had research questions that were articulated on them across the top 45 in particular. I'd say the building block that had the least number of questions was service delivery. And I think that's because we've got lots of evidence on service delivery, and the key question that came through in service delivery was this moving from basic to safely managed, that last hurdle, basically. And so, otherwise across the board they were pretty much even, but there wasn't a preference for people except for service delivery, which I think shows us the kind of direction that we're kind of going in. I've been told to stop now. So. Thank you very much.
Yeah, thank you so much. Thank you very much for all of those contributions. We have our next presenter, which is Claire.
That is a really intimidating presentation to follow. I'm feeling quite nervous. So I'm going to be talking now about water and sanitation regulators as catalysts for universal access. So I want to start with a definition, because everyone sees regulations as very different things. So some people would talk about it as rules and regulations, so imposed by the state. A lot of the people talk about it as all forms of social control, which could be your neighbour or your friends or your dog. So I'm somewhere in the middle. So I'm talking about regulation as behaviour change for policy goals. So led by the government, but with lots of different actors kind of hindering or supporting the achievement of those policy goals. So regulators as catalysts. So this is kind of linked a little bit to the plenary. I'm not sure who attended that, but that discussion about the rise of the regulator, which really made me cheer inside, partly because it's like a kind of Marvel movie title about regulators. And this work really comes off the work which has been being done by Water and Sanitation for the Urban Poor. So together with WASA, the WHO, with the World Bank and others, kind of looking at this trend of the rise of the regulator. and looking at how regulators are maybe working differently, taking on this kind of wider social and technical role, taking on a more supporting role potentially. And this research, so coming off the back of that work that was done with WASUP, which was basically of like field experience, so trying to do some more in-depth research to find out, is this trend something really different and novel, or is it just really good practice? And is this something new which could be learned for others? So this work was being done with really leading regulators, and it's saying, okay, so for others who are kind of coming along that road, then is this something new that could be learned for them? So we did this, initially we started off looking very widely at water and sanitation, then we decided to focus down on fecal sludge emptying and transport. Basically because that is the kind of fastest moving area, so fastest moving in terms of sector reform and in terms of different kind of practices and ways of working. So it's easier to identify positive outliers and easier to kind of understand where there was change. And it's a two-stage methodology. So first of all, we did a reanalysis of secondary data from 33 key informants, so from national regulators, utilities, and municipalities across the globe. And that was from survey data and interview data previously collected. And then primary data collection and key informant interviews with 14 high-performing regulators and utilities or municipalities across the globe. And I'll let you read this for a second if you want. So one of the main sources of bias in the study was really about, they were asking people to reflect on their own practices and their own behaviours. And obviously everyone wants to be a catalyst, right? That's quite exciting. So how we tried to deal with this was by asking about roles, asking about characteristics, and trying to compare that to a really broad definition of established good practice in regulation, so we could see where people were really going beyond that. And so as you can see, this is already, the role of a regulator is so difficult. And this kind of table kind of like reflects the breadth of the role, which is just good practice. So moving on to findings. So the first finding is really about how we were thinking about regulation in the study. So we were considering it in terms of national regulators regulating utilities and municipalities. Was actually what we found is certainly across East and Southern Africa, the main modality is actually that utilities and municipalities are themselves local regulators, regulating service providers, and regulating like a really heterogeneous mix of service providers from established VTOs down to individuals with buckets. And the second thing was really, apart from this like multi-layered regulation, it's the way that local regulators are then adapting and reinterpreting the regulation that comes down from the national level. So looking then at how national and local regulators were going beyond good practice, two main findings. So firstly, in terms of courage and making brave choices, and secondly, in terms of engaging the informal sector. So I'm going to go into those two areas and go back to our initial research questions. So firstly, courage, making brave choices. And the first area was really around challenging power structures. So what we saw, which was quite interesting, was national regulators really challenging their line ministries, really challenging IFIs to work differently in terms of scaling fecal sludge and transport services. And with local regulators looking at that kind of like internal power struggles. People challenging their board, people challenging their senior management to say, no, let's take a walk and let's get this done. And then secondly, it was about going beyond mandates and outside of authority. So there were local regulators that were starting to scale fecal sludge and transport services with no guidance at all. And national regulators having to advocate and producing guidelines before necessarily the kind of like actual instruments that need to be in place. So taking those kinds of risks. And then finally, the courage in taking brave choices around financial risks. And this was very much local regulators, so very much utilities and municipalities, and not making calculated financial risks, but saying, okay, we know we're not going to get this money back, but we have to get started. No, let's get this moving. And this is my favourite quote. I do not have a shit meter, like how hard it is to recover funding for sanitation. So, going back to the research questions, is it different and novel? Is it beyond good practice? And is there something new which could be learned for others? So on that first one, So courage is actually talked about quite extensively in the regulation literature when it talks about regulatory excellence. So Braithwaite and others talk about courageous regulators. And it's also talked about when people are looking at really high-risk sectors like nuclear energy, for example. There's a lot of discussion around moral courage. So it's definitely not new, but we would say it definitely is beyond good practice. And then this is something new which could be learned for others. So I think we would argue no, because actually you shouldn't be having to make really brave choices when it comes to a basic public service. So really we should be looking to reduce the need for courage rather than celebrating this madness of making utilities invest money that doesn't exist for a basic public good. So moving on to the second area, which is around engaging the informal sector. So at the national level, it was really about providing a route for the informal sector to start to engage in formal sanitation services, but in a safe way. So national regulators talking about making like a route for the informal sector to move through, and recognising that they need to be brought involved but not crushed, and recognising that illegality that has to be worked with rather than kind of pushed away, and really keeping both like informal workers and also the local regulators safe in that kind of space. And then secondly, with local regulators, it's really about recognising skills and reaching across the divide. And to say, okay, these guys are illegal, we can still help them to work safely. And interestingly, I guess this comes back to the mandate. We're saying, okay, let's train these illegal workers, even if they don't have licenses, and we know they don't have licenses, let's train them anyhow. At least we can start to make a difference. And this idea of kind of like people hiding from you and then having to kind of like bring people out and bring them forward. That was really, really interesting for the local regulators. So, going back again to those research questions, so what's different, what's novel? There's quite a lot written about engaging the informal sector and about how you need to engage them rather than push them out. So like solid waste, artisanal mining, street food, have all gone through this whole process of initially trying to displace informal workers and legal workers, and then realising that actually the negative impacts, like the social impacts of that were really, really negative. And saying, okay, we need to work differently, we need to bring them in and formalise them. So that part of it isn't different. It's definitely beyond good practice, but it's not particularly novel. But what we think is really novel is this idea of not just seeing informal workers as someone to work with, but seeing them as really a part of the solution, saying these are the only people that can deliver this service in low-income areas, and we need to reach out to get them to work as widely as possible, as safely as possible. So that kind of like mass engagement and using them as an extension of the utility is quite different, and we think is potentially quite unique to fecal sludge emptying and transport. And then is there something new which could be learned for others? So we think yes. And certainly what's up at the moment is also working with SOAS to try and develop guidance for how you can effectively formalise a highly informal sector. Yes, like in a very progressive way and trying to do that at scale. So that's definitely something that we think could be learned for others. And that's it. These are the conclusions again. Multi-layered regulatory systems. We think they should be recognised as such. Local regulators should be recognised as such and supported to develop that skill set. And then good practice. We think it should be extended to include how to engage and incorporate the informal sector. And we should be focusing on reducing the need for courage and recognising those kinds of risky decisions, particularly that local regulators are making, while celebrating those who are making those brave choices. And that's the end.
Yeah. Thank you so much for your presentation. That was really, really good. So colleagues, I am taking questions again for our presenter. Does anyone on the floor have any questions?
Thanks for an amazing presentation. Love the infographic, the cartoons.
Bing AI.
Oh, cool.
I should have cited it, sorry.
Actually, it's more a reflection, but it's kind of, there's really lovely parallels from kind of the informal service providers to things like traditional birth attendants who have very much been incorporated into the kind of like more formalised health sector, because pushing them away was more detrimental both to themselves but also to the population. So there's some really lovely comparisons within the work that just a reflection kind of thinking of that and how structured it's been, and it's
yeah, I mean, there's lots of literature that kind of talks about the benefit of bringing services in.
I'm looking at analogous sectors at the moment, so that's super useful. Just, yes.
Do you have a comment? Do you have a follow-up comment or?
Hi, thank you for the presentation. My name's Donald, I'm from the University of Strathclyde. I spent a bit of time thinking about mainly water regulation in the same region. My question is about some of those kind of decisions were really quite progressive in the way it was looking. How well established were the regulators in, I guess, time, but also finances and position within government is my question. Mainly because I'm dealing with a regulator who is 2 or 3 years into establishment. I'm just trying to see if you have any reflections on, how confident you can be based on if you feel quite well established as a regulator. Thank you.
So, yeah, really good question. Oh, sorry. Yeah, and I should have made it clear actually. So these were all they were positive outliers within positive outliers. So they're progressive thinkers within leading utilities or leading municipalities. And that was very deliberate to find out, what's the kind of most information rich. The regulators were all the most, like people like Webber, for example, like the most established regulators in East and Southern Africa that are really leading the way.
Any further questions, colleagues?
So when you're talking about creating an environment where it doesn't take courage to make the kind of bold and necessary decisions, I guess a question on who is responsible for creating that kind of environment and what would they need to do to create that environment?
Goodness. That's a question. Put it back to the room. Well, everyone, isn't it? So there's a really amazing paper that I always go back to, that organised hypocrisy. It's in a Ugandan water utility and it's in Water Alternatives, and it talks about how it was looking at how water utility was working and the kind of narratives they had going up to the funder and going down to the people that are actually serving, and how actually the funder was kind of, because there's such a strong market narrative in our sector, that actually the funder was kind of forcing them to basically pretend that they were in fact commercially viable, whereas actually they weren't. And so it's that kind of thing. So I think a lot of this is pushed by our market narrative, this idea of like creditworthiness of utilities, and that being some kind of like ultimate end state rather than like universal access being the ultimate goal. So I think there's a lot in the kind of the narrative in our sector that we need to change, I think. And oh crikey, can I put it back to the room? Does anyone ask me? Yeah, I think it's everybody, really. Yeah.
No, you answered those questions quite well. Yeah, thank you so much, Claire. Yeah. Thank you so much. So we are going to have our last speaker, who is Maureen Kesande from the Infectious Disease Institute.
Hello everyone, my name is Maureen Kesande. I don't show there because I'm presenting this on behalf of a friend, so it's a don't shoot messenger situation. But you can shoot me with questions at the end. I'll try my best. So I'm talking about using targeted interventions to strengthen WASH and infection prevention and control in Uganda during the cholera outbreak in East and Central Uganda last year. So cholera is endemic in Uganda, and for the most part, we have slums affected, refugee settings and others. And for the last 5 years, the map shows us where we've had outbreaks of cholera in the country. And the blue is a big Lake Victoria, the largest lake in Africa. And we'll see the significance of what that means as I continue to present. As we were saying, for the most part, what contributes to cholera outbreaks are environmental factors, where we find people, the state of latrines, for example, that is supposed to be a latrine up here, and bathing in water bodies, that is a connotation I'm trying to bring about with Lake Victoria. Washing clothes near water bodies, and etc. So in the map is where the outbreak was, the previous outbreak. You can see it was going along water bodies, and we'll continue to talk about that in the presentation. So the intervention the approach that we used was a cluster and grid approach. And how we did this was to look into the high-risk sub-counties in the affected area, and clusterize communities without cases, but within the high-risk sub-counties, and then look at the cholera cases clustered within the communities. So the clusters that have cases, the clusters that do not, and then the entire high-risk community, so that interventions are aligned to the situation within the sub-county. So where we had more cases is where we concentrated the interventions. So the interventions were mainly WASH and IPC interventions, and we clustered these according to epidemiological data and other investigations that guided the interventions that I'm talking about. This cluster and grid approach was borrowed from a study that was done in DRC 2018, and we saw very good results from it, and so we decided to use the same approach and see how this worked. So in the end, that's the epi situation that happened, but I'll talk about the most affected during the 2023 cholera outbreak. We saw that the ages between 15, I don't know, I'm sure it's not so visible, but 29 were the most affected, and we had about 26 confirmed cases of cholera. That was really big. And how this came about was somebody came in from a neighboring country and they had cholera symptoms, and then they later died. And the diagnosis at the hospital was something to do with respiratory failure and things like that. So we didn't take, there was not much attention that was put on the urea that was presenting at that time. Until after the burial, 2 other people died in the same community, and so we began to suspect that this could be a diarrheal disease. So later, tests were done and it was confirmed, and we started, of course, the interventions, water treatment tubs, of course, prophylactic antibiotics were brought in by WHO, UNICEF, and then later, when we began to see that clusters were building along the water bodies, the River Nile, the Lake Victoria, we had to stop fetching water from those areas. So there's I think somewhere it shows, yes, that we prohibited people from using River Nile water at some point. So the other interventions, of course, were community sensitizations, community leadership engagements, because we had to bring as many people on board to try and spread this messaging. Hand washing facilities as usual, but also health facility mentorships. What do we, of course, for health facility mentorships is something that we have been using in Uganda in Ebola outbreaks, in COVID. This is the kind of methodology we used, where we had mentors visiting hospitals, providing capacity building for hand hygiene and other IPC standard precautions. In the end, what we saw our intervention doing at community level was, there was, in 26 days, it was a total of 26 days of response, and in those days we visited over 6,000 households using the community structures. So the lowest level of the health system in Uganda are what we call village health teams, and so these people have a very good network within the villages. So we relied on that network to try and sensitize the households, and with that we were able to reach about 6,000 plus households, giving them health messaging and guiding them on water treatment, hand hygiene, and others. So at the health facilities, of course, we used an assessment to know at the baseline, at the beginning of our interventions where we were, and then after the interventions where we were at. So we used a tool that was developed by the Ministry of Health, and together with UNICEF, that tool was originally for just infection prevention and control. So with UNICEF, we were able to add in some WASH questions so that it can be a joint tool because the interventions are both IPC and WASH. We can see on the left is before the interventions, which were IPC and WASH interventions I've just described, and then on the right is where we can see a lot of improvement from the interventions that were done. This might be not very clear, but one of the things I wanted to point out, I was saying if I can zoom in. So one of the things I want to point out is that some of these interventions will improve and others won't. And those that won't improve are infrastructure. Things like water supply within an outbreak. We won't have people building pipe water systems. So we don't see an increment in that. But we will see an increment in hand hygiene, we'll see environmental cleaning increasing, and the other thing that didn't increase, of course, was bed capacity. No one was bringing more beds into the treatment unit. So such things remain static, although we saw improvement in other parameters. Yeah, so this is the end of the presentation. I wanted to make sure we keep within time for questions. And these are the, we acknowledge the US CDC, which, with which funding we're able to do all this work, the Ministry of Health, health workers, the district level governments, IDI, the Infectious Diseases Institute, where I work, and the district village health teams. Thank you so much for listening.
Thank you, thank you. That was very thorough and quick. Thank you very much. Any questions on the floor?
Microphone, or can I just be Maureen, I know that you might not be able to speak to this, but out of curiosity, I'd love to hear more if you know about what the health facility mentorship specifically looked like. Yeah. Do you have any insight into that for the group? Love it.
So I was privileged to design the mentorship approach during the Ebola outbreak and also scale it up during the COVID pandemic. So what this means is that we attach a trained health worker and train this person in different parameters. So in a health facility and community settings, it will be different. But in essence, what we want to do is have this person or a mentor visit the health facility in a frequency, maybe 2 times a month or 3 times a month, interfacing with health workers, a sort of a CME. And we have a schedule where we say, okay, in this first session, we'll talk about hand hygiene and make sure we do the practical bit of it. The next session, we'll talk about waste management, and until we finish the standard precautions of infection prevention and control, which include environmental cleaning, hand hygiene, injection safety, and others. So it's sort of a program where the mentor continues to visit the health facility and build capacity of health workers. So it is a preparedness tool. It's not a response tool. Because during a response, you don't want to be doing CMEs. You want to build capacity before the outbreak actually happens. So it should be a continuous process. But in the event that the health workers have not been trained, you may want to do a quick, rapid capacity building approach, and we think the mentorship is the best.
Hi. Do shut me up if you're not willing to answer this one and defer to someone else, but Marsha Glenn, USAID, I'm posted in Haiti. So there are a lot of similarities to what we're going through in Uganda and the cholera outbreaks, recurrent cholera outbreaks in Haiti. Considering the fact that this is a recurrent disease, has there been any changes with regards to having those responsible for providing clean water in the regions affected? Or are you just prepared to continue doing the emergency healthcare and health facility responses each time over and over. Has the utilities, the responsible utilities or the responsible ministries changed, got additional financing to mitigate a recurrence, some kind of sustainable response for sustainable water services to prevent people accessing unsafe water?
You're so calm. You speak so calmly. You calm me down some. So yes and no. Of course, it's the government priority to have water systems running, with or without an outbreak, in peacetime and wartime. The issues with resources will always, affect. I mean, there's a lot that the government is looking at supporting in the local system and in the community setting. So a lot of support is coming from development partners. But what we need to do, of course, as development partners is align to the strategic plan of the government. So, for example, what we normally do at the beginning of the fiscal year is visit the Ministry of Health, the Environmental Health Department, request for their strategic plan. So that as we design interventions or as we make our own work plans as development partners, we are aligning to what the government is planning to do. So what the government decides to be priority, we also prioritize that and key into that, so long as it's within our portfolio. But I also like to say that a lot of work is being done at the community level by different partners who are mostly investing a lot of resources at community level. The households are biggest stakeholders in this, and they are biggest funders for the most part. So investment has been put in them to understand, have awareness of the need for water, all right, and then be able to sustain the few resources that are available. For example, if there's a borehole, how do we maintain it? How do we keep it clean? How do we make sure it takes us longer than it, instead of destroying it? So there's all those interventions happening, and with the continuous financing, we see the situation improve.
Thank you so much for that question. I've got one question as well for you. Seeing that this type of disease, like cholera, has been reoccurring, I think it's also touches a bit on aspects of behavioral change. So to what extent actually were communities involved in the planning and the designing of some of the interventions that you were implementing on the ground? Because at the end of the day, we need to consider them as stakeholders as much as they are users. So, yeah.
Yeah, sure. Yeah, so the champions for awareness, creating awareness and messaging will come from the community. So if it is a chief within the community, or if it's an LC1 leader or the local council leader, or the church leaders, these are the people that we rely on for risk communication. So the pillars of outbreak response, of course, are very many: case management, logistics, infection prevention and control, case management. But we have the risk communication pillar, which has the mandate to make sure health messaging, health promotion is going out. What about the IEC materials? How are they in the local language? So things like that. And what I talked about in the presentation was looking at the lowest level of the health system on ground, the village health team, or what we can call community health workers. So those are the liaison between the health system and the communities. And so we rely strongly on those. But they tend to get overwhelmed because all the interventions tend to go to them first. If it's TB, I will want to go to the village health team so that they can do the TB dose. If it is HIV, we are relying on them to remind people to take the antiretroviral. So they kind of get overwhelmed. So I think thinking about ways of harnessing other community structures to augment that network, to increase the network so that we can have a lot of community work happening. But again, to answer your question, we leverage and involve the communities in the planning. We bring them on board to understand what is happening, what is cholera, how does it spread, so that they can run with the message and help us to build a lot of awareness in the communities. Thank you.
Thank Thank you so much for that presentation. And thank you so much as well for all the lovely questions that we had from our audience. I just have one question, last one, since we have a little bit more time, to all our presenters. If you had an opportunity to mention one thing that you believe could be done differently at an institutional level, what could it be to ensure that there is effective governance, effective policy or legal banking and stuff? Like, what should our leaders do differently to ensure that all your research and your work is implemented accordingly?
It's just the first thing that's coming to my head. But I think maybe like thinking about changing practice rather than bureaucracy and paperwork, I suppose. Like that. Like.
Nice.
It's quite a hard question because it's on a systems approach, and systems is one factor, it's many factors coming together. But maybe that's what I would say is that you have to have a more comprehensive view of the interacting factors that come together in order to improve change.
Fantastic.
I think the last presentation covered it with trying to think about how to incorporate what people need and their lived experiences into the planning process at a large scale.
Thank you. Those are fantastic answers.
So, my leaders are in the room. So I can't be saying certain things. Right. Yeah. If I fail to come through, I know Jen in the corner will come through for me. So I wanted to, I love system strengthening. I think that's where everything begins. And that will be where I start, strengthening the system so that it is resilient. When we are faced with outbreaks like the one I was talking about, we have already built capacity, resilience to be able to withstand outbreaks of such magnitude. Yeah, that will be it.
Thank you so much for all those fantastic contributions. As I close the session, I believe that the presentations were very robust, very comprehensive and insightful. I hope that every single one of you learns a thing or two and you have many of your questions answered, because I believe that in this sector, there's so many challenges that still need to be addressed. And I think what really came through for me was that there is really a need for like cross-sectoral collaboration and governance to ensure that we strengthen our systems, to ensure that regulation is effectively implemented, but to also ensure that communities and some of the interventions that are designed by people and institutions are effectively implemented on the ground, but also not to forget like subsidies and tariffs as opportunities or aspects that need to be covered as well to ensure that there is an efficient and sustained system within the sector. So as I close, thank you so much to everybody that attended. I really, really had fun watching all the presentations and everyone did so well. Thank you.